the Evergreen Media Network Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. Each week, I come before you as the CEO of Treasure Coast Community Health because I believe it's important for us to have great communication, not just about healthcare services, medical, dental, behavioral health, those things that we provide at all of our Treasure Coast Community Health various sites, but also because we have a lot of great partners and a lot of health-related things that happen in our county. And so it's my honor to be able to bring guests in to talk about those things. Now, just for clarification, Treasure Coast Community Health is a federally qualified health center, which means we get a very small competitive grant from the federal government. There is no money tree in our backyard. We are a nonprofit. And so donations are always welcome because as a federal safety net, we accept patients of all nationalities, ages, insured, non-insured. We turn no one away. We do ask for people to make a nominal amount of donation to us if they are uninsured or even underinsured. But we recognize that healthcare for all is our mission. And that doesn't mean just all poor people. We take care of middle class and those that have choices with lots of insurance and lots of providers, even across different state lines. So if you're looking for a provider, I would hope that you would consider us. We are not the health department. We are really much more like a private practice supersized with a lot of different comprehensive services. But enough about us. I'd like to introduce my guest today because us has expanded over this last year as we were identified of an opportunity to take care of those that are our patients often Monday through Friday, but then they do something that shows maybe a lack of judgment or a struggle with substance uses or other mental health conditions where their judgment hasn't been the best, and they end up for a short stay in our local county jail. And so Jodi Oliver, I always mess up your name, Jodi. I'm so sorry.
Everyone does.
Everyone does,
no
unless
problem.
they're Italian, right?
Yes, exactly. So, it's Olivadoti.
Thank you.
Yes.
So Jodi joined us about 2 years ago.
Yeah, it'll be 2 years next week.
Came on board as a case manager, an experienced registered nurse. And when we were offered the opportunity to see if we could offer better services at our Indian River County Jail, Jodi jumped right up and said, I want to do that. And we were like, no, stay here. And she said, well, here is just broadened. And so for the last almost year and a half,
correct,
Jodi has been helping us run the medical portion of the jail, which again is not just medical, is it?
No, it's not.
Describe the services that you're providing.
So, you know, obviously with the background in case management and quality, I was intrigued with corrections nursing because, as we all know, patients come in, they need a service like anyone else, but it's rare that there is a follow through with the care. So one of the things I function as the health service administrator. I'm a registered nurse. My background is in acute medicine, so I did years of ICU. So I felt that I was prepared to be in an environment that operates like a hospital in many ways, a clinic.
24 hours a day,
24 hours a day.
Week.
And so I'm surrounded by a wonderful group of clinicians, providers, and they help us manage the care of the inmates while they're in the jail. Some of the inmates are then released back into the community. Others are transferred to other facilities, DOC, whatever it may be. But my interest, obviously, was so that we could provide a better quality of care than what I had heard the inmates were getting at the time.
Well, I would guess that that's been an overwhelming success because when I do come into the jail, invariably I have one or two people that are incarcerated ask to speak with me and say, this is the best care that they've ever received anywhere.
Yeah.
They don't say in any jail, they say anywhere. And so kudos to your staff for doing that.
Well, and kudos to TCCH because it's a model, and I believe there are 5 in the country at this point, right? FQHCs are in the state of Florida that we're aware of.
Because it's not endorsed for federally qualified health centers to do this.
Right.
Typically, who provides care in the
vendors,
jail?
Commercial vendors. You have your
for-profit organizations.
For-profit organizations, WellPath, Corizon, Airmark. I can't remember the other one, but there are those that are very popular in this setting, and all they do is go into correctional facilities and provide the medical care. So this is very different, and it's beneficial in some ways because we can write our own path in many ways by a certain standard. We have to follow Florida model jail standards, which are the basic standards that all jails do have to follow. Mm-hmm. But then we can look at processes that include reducing recidivism and how can we impact that by implementing such and such a protocol. So there are things that we can do because we're an FQHC, I think differently than just a broad plan of care that you would find with a commercial or a for-profit vendor.
Because at that point, once that individual is discharged, there is no continuity of care.
There's no continuity.
There's no soft landing. There's
Right.
no place set up for them to have their care continue. Now, for many people, that's a non-issue because they say, I didn't get care before, I'm fine.
Yeah.
Okay.
Yeah.
But how many individuals really get discharged without any medication support, without any mental health support?
Yeah, it's unfortunate because I'm sure that number is great, and I wish I had the statistics. It will be an interesting thing on our part to pursue that kind of information to see, numerically, how many people have we affected? How many people came in without that kind of continuity and care in the community? How many chronic care conditions came into the jail? And how many of them are now more controlled and are being cared for in the community? So unfortunately, I would guess that it's a very large number of inmates that come into jails, no matter where they are. They're provided with services and then they're released, right?
Minimally.
Mm-hmm.
Because it costs money
Right.
to have you all at the jail.
Right.
So if you're a for-profit,
Mm-hmm.
you want your profits to go to
Of
your
course.
shareholders,
Yeah.
stockholders, not reinvested back into those people.
Right.
Okay.
Right. I agree. Yeah.
And so as you're providing the care, you're keeping the documentation so that longitudinally over time, we can take a look at that impact.
Yeah.
But you've been there for more than a year.
Yeah, about a year and a half.
And I know there have been some things that we have noted in terms of differences you've made in the care for those individuals.
Well, yeah, the first is identifying issues. So historically, an inmate came in through booking. They were asked 5 questions by custody staff, far as 5 questions about what their medical history may entail or communicable diseases they may have. And then
Sounds pretty bare bones.
It was very bare bones. Obviously, they followed the FMJS standard, as they should. And then they were sent off to medical. So nursing would be notified or the provider would be notified that there was an inmate that came in with some kind of medical condition. The difference is now we are doing a comprehensive 8-page interview when the inmates come in, and it includes everything from what is your mental health history, what medications were you taking in the community, who is your community provider, do you have a mental health professional that you see, do you have an alcohol history, do you have a drug history, how much do you consume, how do you manage withdrawal, have you ever been hospitalized because of withdrawal? There's so many questions we ask, including infectious disease issues, things that we have to be concerned about in that environment. That we obviously want to prevent, but it allows us to initiate a plan of care as soon as they walk in the door. And so then we can anticipate those that come in with chronic conditions that may have not been taking care of themselves in the community and perhaps offer them some education and an opportunity for when they're released.
So you've mentioned chronic care a couple of times. So before we go to break, I'd like you to clarify, what kinds of chronic care conditions do you see in the jail? Because when I used to think of jail before I was actually walking through with you, you know, my sense was it was a lot of young people, and how much chronic care could they have? That most of them had perhaps mental health or substance use disorder issues, because we all learn from an early age every action has a consequence, and so most of us learn that we don't want the negative consequences, and it sort of modifies our behavior. These folks that are struggling with those two issues obviously are still working on that.
Yeah, and mental health in and of itself is a chronic condition. And I think when people think of chronic conditions, they think of diabetes, hypertension, cardiac disease, lung disease, and those all are chronic conditions and obviously need to be managed. But when you're dealing with someone with a mental health condition, they typically just, you know, because it's a mental health condition, I think there's this stigma, and a lot of people don't take it seriously, or they don't want to address it, or they reduce the importance of it in some ways. And so they aren't managed as well as they could be. And if they manage these mental health issues, they're less likely to depend on drugs and alcohol to manage their anxiety or behaviors. And then they're less likely to suffer a physical outcome, a negative outcome physically, whether it be neuropathy from any kind of drug use, you know. So there are so many things that go into it. When they start using, because they don't know how to manage mental health issues, there are so many things that it opens the doors to: hepatitis, you know, communicable diseases. So getting them at that point initially when they come through receiving and identifying where they are in that disease process is really important.
Well, and I absolutely agree with that. And you brought some things forward that I even haven't thought about. But I also think about the diabetic who might get picked up. And when you get picked up and put in jail, there's no, let me stop at the house and get my insulin or my blood pressure medication, or the things that, again, I wasn't thinking as a young person would have a chronic disease, but you have every age from 16 all the way up.
And we see more and more young people with diabetes, and it's pretty sad. You know, don't forget, a lot of these people are living on the streets. Think about what their diet consists of. So they don't have the time or sometimes the education to understand what's contributing to that disease process. So when they come in, especially the diabetics, we are sure to have things on stock so that we can initiate therapy almost immediately. So within 48 hours, we typically have verified medications if they're on medications in the community. We've called the pharmacy that they go to. We know about any active medications they're receiving. Or if they're not on anything, our provider sees that inmate and pretty much implements things right away.
No wonder nobody wants to leave now.
Honestly,
I'm kidding. I'm kidding. So we're going to take a short break for a word from our sponsors, and when we come back, we're going to talk more about the details of what changes have been made in the jail and answer any questions between us. Thank you. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, including lots of slipcover styles from Universal, Four Seasons, and Capri. We also have a gallery of Tommy Bahama and Lexington with styles designed for a relaxed approach to the finer things in life. We're having a summer sale with lots of great markdowns, including all in-stock Lloyd Flanders 25% off. Sunshine Furniture, 1295 US 1 in Vero Beach, next to Planet Fitness. Family owned and operated since 1991. Don't forget to visit our outlet and sales store directly across the street and visit our website at sunshinefurniturecasual.com.
Sunshine Furniture brightens up your day. Sunshine Furniture, the best in every way. Ooh, having sunshine, yeah. Sunshine. Furniture.
When life is a struggle, getting help shouldn't be. Unstruggle.org is a place for you to find providers, have appointments on your behalf, and help eliminate the barriers that many people face when seeking mental health treatment. We're here for you. Unstruggle.org.
Start your day with fuel in your tank with breakfast at Marsh Landing. You'll love our biscuits and gravy, sweet potato pancakes, or eggs Benedict with a fried green tomato. And how about a mimosa or a monster Bloody Mary? It's breakfast, old Florida style, at Marsh Landing in Fellsmere.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health and a proud boss lady of almost 300 individuals who provide caring, compassionate, well-mannered, and high-quality services for all members of our community. I'm here this week to hit the banner that we're not just for poor people, although we do a bash-up job for everyone. In the old days, we used to be known as just for those people, whoever those people are, that no one wanted to have in waitings with them. But the reality is we hire all board-certified, experienced, caring, qualified individuals who take the time to understand each person's situation. And so with that reputation, we were asked to bid on what is typically a request for proposal for services in our county jail. And that took place a couple of years ago. And we are today talking with Jodi, who is our health services administrator there, a registered nurse of some experience. And she leads a crew of about 30 over at the jail. We have a medical director, of course, but we also have a number of other supportive people. You want to run through that,
Sure.
who you've got on staff?
Yeah, so we have Nancy Loriano, who's our PA. She's our mid-level provider, and she is overseen by our medical director, Dr. Valeriano. We have a nurse practitioner who comes in twice a week to manage our chronic care clinic. We have a psychiatrist on site. She is there 3 days a week. She works remotely 2 days a week, so we have her quite a bit. She primarily works with the inmates for their initial evaluations for mental health. We have a licensed clinical social worker, Zamaris Webster. She is primarily our counselor for the inmates. And does a wonderful job.
Counseling in a jail.
It's wonderful.
What a wonderful idea.
We also have dialysis on site. We currently have one inmate who requires dialysis 3 days a week, so we use a third-party vendor. All the equipment and machinery is set up for that 3 days a week.
So they no longer have to go out the way they used to?
No, when we started there, they were going off-site for dialysis treatments, and we partnered with this third-party vendor who was able to provide us with those services, so it's been really a blessing. We do on-site labs, so inmates don't have to go out for lab draws. We have many machines. We're CLIA waived for... We do the majority of them and get instant results right on site. Some of them we do have to send the blood off to Quest, and we process that through Quest. We also have a third-party X-ray and ultrasound company that comes in weekly, so we provide services for anyone needing X-rays or ultrasounds. We also have a company, it's a third party that comes in to help us manage our HIV, hepatitis C, STD testing and management of those diseases. And they come in weekly on Thursdays. For any inmate who's concerned, we sign them up, and sometimes it's just what they need to have some peace of mind. Yeah.
So two things occur to me.
Sure.
One is that because you have brought so much in-house, and with Ms. Loriano experienced in emergency room work, she does whatever stitching might be necessary if there's an accident or event. Altercation, thank you. So how has that reduced the number of trips to the emergency room here locally?
Well, significantly. I ran statistics, and I do that frequently. I like to see where we were compared to where we are. I think it's important for us to know where we need to improve our services. We are at a third of the ER sendouts that the jail was last year at this time. So we had 48 in the past year transfers out compared to their 150.
So that's really saving taxpayer dollars.
Absolutely.
Because every time an inmate goes out, 2 sheriff's officers accompany.
Depending on the level, if it's a higher level inmate, 2 custody staff. If it's a female, 2 custody. So it depends on the person, but tremendous amount of cost savings there. Not only that, but the ER cost itself, and
which is not insignificant,
right?
Yeah. So that's a really great thing. And one of the things that I know you've been working on is NCC standards. So as I understand it, you tell me what NCC stands for, but I think of it as the JACO of jail services.
Yeah, it's a good way to look at it. So it's a National Commission on Corrections Healthcare. That's what NCCHC stands for. And they have been around since the 1970s. So it started, actually, it was it branched off from American Medical Association, where back in the 70s, they identified that they needed a separate level of care for corrections medical care.
Okay.
And they obviously were finding that the standard of care wasn't that great. So we follow the Florida Model Jail Standards, which they're basic standards. They're not bad standards. They hold both custody and medical accountable.
Okay.
Whereas NCCHC is strictly medical standards. So everything is focused on, it's more of a holistic focus than FMJS. FMJS very much focuses on the here and now. How are you caring for the inmates? Do they have access to care? NCCHC really does take that whole release into consideration, what we were talking about, preparing these inmates with chronic conditions to go back in the community. That's where this all comes into play with NCCHC. So the standards are much higher. That's where the receiving screen, the 8-page receiving screen, comes into play. It's more of a proactive approach with NCCHC.
And how long does a jail usually prepare for that? And how many jails actually pursue NCC standards? Any idea?
Well, I don't know the numbers, but I know that it's not easy to achieve. And just speaking with a colleague, you can become accredited in NCCHC. You don't have to be. You can follow their standards, but you can become accredited, and that's our goal. And our goal is by 2025 to be accredited.
Well, good for you.
Yes.
If you don't have a goal, you're not going to reach it.
That's right.
And I know that that's a very ambitious goal.
It is.
From a taxpayer's perspective, though, I'm going to be devil's advocate and say, why bother? These people are going to end up in jail again. Why are you going through all these hoops?
Because those taxpayers are also community members. And we want a better community. And if we are preparing those inmates for release, whether it's managing their health, managing their mental health, managing their drug addiction, we will be a better community.
Well, and I have to offer a PS. It's a rare family that can say, I've never had a family member overnight in a jail. The rules have changed.
It applies to everyone.
We want greater accountability of individuals, and we all make mistakes. We're all human.
Absolutely.
Okay.
Yep.
And so not holding back care for them is an important part of our mission as well.
Absolutely.
So thank you for all you and your staff do.
Appreciate the
I'm going
time.
to have you come back again because I know you've got some individual programs that you're going to be putting in place as part of that accreditation. And so we'll see you again in a couple of months.
Thank you.
Thank you for being here with us. And thank you all for being on board until the very end. And I hope you hear from us again next week on Saturday at 4:30. Have a great night. Bye-bye.